Hello, welcome to this video on the utility of clinical trials in sickle cell disease. My name is Rachel Kesse-Adu. I'm one of the sickle consultants at Guy's and St. Thomas's Hospital. So what is a clinical trial? It's essentially a research study which involves patients. Clinical trials are usually carried out to help us assess new treatments or new investigations, or possibly new ways to prevent illnesses such as new vaccines. They can also be used to study methods of diagnosing disease, so laboratory tests, for example. Why do we need clinical trials? We need them to answer these three basic questions. As far as treatment goes, we want to know, does the treatment work? Is it better than what we currently use? Does it have any side effects? When a new treatment is introduced, it has to be both effective and safe. After all, the ultimate aim of all treatment is to improve your health as well as quality of life. Clinical trials are carried out in a number of stages. The very first stage is known as the preclinical phase. This is all the work that is done before any testing occurs in humans. It's usually extensive. It's usually carried out in the laboratory on human cells and sometimes on animals. And what you want to find out when you're doing the preclinical testing is your new drug, should that be what you're testing, is it doing what you want it to do, where you want it to do it? Data from preclinical phase testing is what is ultimately submitted to the agencies that will issue approval for any testing in humans to commence. The preclinical testing phase lasts a variable amount of time. So, for example, a drug called poloxamir, which was trialed in sickle cell between 2010 and 2017, was in its preclinical phase in the lab for about 32 years before any in-human test happened. The next phase of a clinical trial is phase 1. This is the first stage of testing any new drugs in humans. The questions that are answered by phase 1 trials are how safe a new drug is and how well it is tolerated. Phase 1 trials are usually quite small. They have somewhere between 10 to 20, either all healthy volunteers or a mix of healthy volunteers and patients. Sometimes a phase 1 trial can be an entirely inpatient trial. For example, if a new medication is an anti-cancer medication. Phase 1 trials may be open label. This means all participants are aware of what they are receiving, although more rarely they may be randomized and controlled, and I will explain what that means later. Randomized and placebo controlled. Most drug companies who develop new drugs and carry out phase 1 studies will compensate you for your time if you take part in a phase 1 trial. It is good to understand that all phase 1 trials undergo a rigorous ethics assessment process before they start, and all patients who take part in a phase 1 trial will be fully informed on all the information available on a medication that they will be taking as part of the trial. And any developments while the study is happening will be communicated to patients if it is deemed significant. The next phase is a phase 2 trial. The main aim of this stage of clinical trials is to confirm effectiveness. It also further checks for other safety issues and also monitors for side effects. Phase 2 trials are generally larger than phase 1 trials, but usually still have less than 100 patients involved. Phase 2 trials almost never have healthy volunteers taking part, and usually the population will consist entirely of patients. Phase 2 trials are usually both randomized and blinded, and usually involves either a placebo or something fairly similar. So what is the point of randomization and what is the use of a placebo? A placebo, of course, is a drug that does not have an active ingredient. So, for example, if a new therapy is an infusion, if you receive a placebo, you're likely to just be given standard hydration fluid rather than the active medication. So this slide gives an example of the use of a placebo-controlled trial. So a couple of centuries ago, when lots of people used to travel via sea to discover new lands and new continents, and these journeys used to take a fairly long time, you would have a bunch of fairly healthy sailors leave their set off on a journey, but by the time they returned, half the crew may have died, and a lot of them would return with an illness which was later labeled as scurvy, and nobody could figure out why this would happen. And a variety of treatments were used, and no one quite knew how to correct it. So on one journey, the captain decided to divide his crew into two groups. One lot would be given lemon every day, and the other lot would receive a shot of rum every day. You can imagine most of the sailors would have preferred to have received the rum, so the lot who got randomized to receive a lemon a day were not the happiest of the crew. However, by the time they returned from the trip, the sailors who had received the rum did not have scurvy, whereas the sailors who had received the sailors who had received the rum all had scurvy, whereas the sailors who had received a lemon did not have scurvy. And this is how we eventually discovered that scurvy is caused by a lack of vitamin C. The next phase of a clinical trial is a phase 3 trial. This compares the effectiveness of the new therapy against pre-existing or standard therapy. Phase 3 trials are usually massive trials with hundreds of patients in it. Again, patients are randomized because at this point we still do not know if the new therapy is superior to pre-existing standard therapy. Phase 3 trials is where the data is generated to apply for a license to then start using a new medication as part of routine therapy. The final phase of a drug trial is a phase 4 trial. This is what is done after a medication has been licensed. So all medications that we use in healthcare, if anyone has any significant side effects, we fill something called a yellow card to report the side effects, and it is noted and information is collected. And sometimes, many years down the line, a drug can still be pulled from use because of an accumulation of evidence over a number of years. So a phase 4 of a clinical trial essentially never ends. So what clinical trials have been done to date in the world of sickle? Quite a number, actually. This graph shows the improved survival of sickle patients from the turn of the last century till relatively recently. And you can see the arrows are pointing to things that most people are probably quite familiar with. Most patients who will be listening to, watching this video will be on penicillin. Quite a number of you will be on hydroxyurea or hydroxycarbamide. Quite a few people have probably had transfusion at some point. So the arrows all point to clinical studies that were done to show that these various therapies all improved survival and resulted in a better condition in our patients. This is not all of the story. In fact, even this slide is not all of the story. The number of trials that have been carried out in the world of sickle could not be summarized on a single trial, but this are some of the ones that we think of as our landmark trials. So you can see clinical trials have been ongoing for a number of years. Probably the most significant one is the MSH trial, which showed the utility of hydroxycarbamide or hydroxyurea. in the world of sickle. So we've been using hydroxycarbamide in standard clinical practice since the mid-1990s. Baby hug is affecting how hydroxycarbamide is used in children. So now all children from 9 months of age, we know, do much better if they start hydroxycarbamide than not. And then there are a number of other trials summarized on this slide. And so clinical trials are very important, very essential to evolving care and improving care. This last slide just gives you a small flavor of some of the more recent drug studies that have been undertaken, and some remain in clinical studies. So crinzolizumab, which is on the box, is called Oxybrita, is actually licensed for use in America. It's a medication given as a monthly infusion which reduces sickle cell pain. There are clinical studies currently running in the UK with this medication. GBT440 is now known as voxelotor. This is a medication, again, used for sickle patients. It improves hemoglobin level. Again, it is licensed in the USA and is used as part of standard care for sickle patients, but is going through the licensing procedures in Europe and the UK. Poloxamine was the drug I mentioned that had been in the lab for about 30 years before they came into the clinical trial setting. Unfortunately, the clinical trial for poloxamine, despite all the laboratory evidence, did not bear fruit. So the trial closed after a few years because the patients who took the drug versus the patients who were on placebo showed no difference. So there was no benefit from taking the drug. It certainly didn't cause any harm either. And these are a couple of other there are many more drugs that are coming through in clinical trials, which is a positive thing for the world of sickle because we've had so few drug therapies available. And then for curative therapies, bone marrow transplants. So you can have a bone marrow transplant in the USA if you have a matched sibling as a standard of care, if you fulfill a number of other criteria. In the UK till recently, that was only available for children, but based on the trial evidence accumulated across the world, it is now also treatment that's going to be available for adults. However, half much bone marrow transplants will go into clinical trial in 2021, and other clinical trials are happening across the world to collect data on the utility of that therapy, as is gene therapy. These are all treatments we're hopeful will be available to use in the clinic very shortly. I hope these set of slides have proved useful and have given you some information about the use of clinical trials and why your participation in them is so invaluable. We are not able to move forward the treatment without your help. So thank you.